ਸੋ ਅੱਜ ਦੇ ਇਸ ਵੈਬੀਨਾਰ ਦੇ ਵਿੱਚ ਸਾਡੇ ਅੱਜ ਦੇ ਮੁੱਖ ਬੁਲਾਰੇ ਡਾਕਟਰ ਸਵਰਨ ਸਿੰਘ ਰੰਧਾਵਾ ਉਹ ਸਾਡੇ 'ਚ ਪਹੁੰਚ ਚੁੱਕੇ ਨੇ। ਸਾਡੇ ਲਈ ਬੜੀ ਖੁਸ਼ੀ ਦੀ ਗੱਲ ਹੈ ਕਿ ਜਿਹੜਾ ਇਹ ਬੜਾ ਲੋਕਡਾਊਨ ਦਾ ਪੀਰੀਅਡ ਸੀ, ਜਦੋਂ ਅਸੀਂ ਜਿਹੜੀਆਂ ਸਾਡੀਆਂ ਰੂਟੀਨ ਦੀ ਐਕਟੀਵਿਟੀਜ਼ ਨੇ ਜਿਵੇਂ ਸੈਮੀਨਾਰਸ ਜਾਂ ਟ੍ਰੇਨਿੰਗਸ ਉਹ ਨਹੀਂ ਕਰ ਸਕੇ ਸੀ, ਪਰ ਅਸੀਂ ਟੈਕਨੋਲੋਜੀ ਨੂੰ ਵਰਤਿਆ ਤੇ ਉਹਦੇ ਨਾਲ ਲਗਾਤਾਰ ਅਸੀਂ ਇਹ ਸੈਮੀਨਾਰ ਜਿਹੜੇ ਆ ਆਰਗੇਨਾਈਜ਼ ਕਰ ਰਹੇ ਹਾਂ। ਅੱਜ ਦਾ ਸੈਮੀਨਾਰ ਪਸ਼ੂ ਪਾਲਣ ਵਿਭਾਗ ਪੰਜਾਬ ਐਕਸਟੈਂਸ਼ਨ ਵਿੰਗ ਅਤੇ ਗੜਵਾਸੂ ਲੁਧਿਆਣਾ ਦੇ ਕੋਲੈਬੋਰੇਸ਼ਨ ਦੇ ਨਾਲ ਆਰਗੇਨਾਈਜ਼ ਕੀਤਾ ਜਾ ਰਿਹਾ ਵਾ। ਸੋ ਜਿਹੜਾ ਸਾਡਾ ਟੌਪਿਕ ਅੱਜ ਜਿਵੇਂ ਦੱਸਿਆ ਜਾ ਗਿਆ ਪਹਿਲਾਂ ਹੀ ਕਿ ਹੂਫ ਮੈਨੇਜਮੈਂਟ ਤੇ ਡਾਕਟਰ ਸਵਰਨ ਸਿੰਘ ਰੰਧਾਵਾ ਦੀ ਇੱਕ ਮਾਸਟਰੀ ਹੈ ਇਸ ਸਬਜੈਕਟ ਦੇ ਉੱਤੇ। ਸੋ ਉਹਨਾਂ ਨੇ ਸਾਡੀ ਬੇਨਤੀ ਨੂੰ ਪ੍ਰਵਾਨ ਕੀਤਾ ਤੇ ਅੱਜ ਸਾਡੇ ਵਿੱਚ ਸ਼ਾਮਲ ਹੋਏ ਨੇ। ਜਦੋਂ ਪਿਛਲੇ ਵੈਬੀਨਾਰ ਕੀਤੇ ਸੀ ਤਾਂ ਸਾਰੇ ਫੀਲਡ ਸਟਾਫ ਤੋਂ ਇੱਕ ਡਿਮਾਂਡ ਆ ਰਹੀ ਸੀ ਕਿ ਇਹਨਾਂ ਦੇ ਸਰਟੀਫਿਕੇਟ ਜਿਹੜੇ ਨੇ ਉਹ ਇਸ਼ੂ ਕੀਤੇ ਜਾਣ। ਸੋ ਡਾਇਰੈਕਟਰ ਸਾਹਿਬ ਨੂੰ ਅਸੀਂ ਬੇਨਤੀ ਕੀਤੀ ਤਾਂ ਉਹਨਾਂ ਨੇ ਪ੍ਰਵਾਨਗੀ ਦੇ ਦਿੱਤੀ ਤੇ ਇਸ ਵੈਬੀਨਾਰ ਦੇ ਵਿੱਚ ਜਿੰਨੇ ਵੀ ਸਾਡੇ ਫੀਲਡ ਵੈਟਸ ਨੇ ਉਹਨਾਂ ਸਾਰਿਆਂ ਨੂੰ ਆਨਲਾਈਨ ਪਾਰਟਿਸਿਪੇਸ਼ਨ ਜਿਹੜੇ ਸਰਟੀਫਿਕੇਟਸ ਨੇ ਉਹ ਇਸ਼ੂ ਕੀਤੇ ਜਾਣਗੇ। ਕਿਵੇਂ ਇਸ਼ੂ ਹੋਣਗੇ ਉਹ ਅਸੀਂ ਜਦੋਂ ਵੈਬੀਨਾਰ ਦੀ ਸਮਾਪਤੀ ਹੋਵੇਗੀ ਉੱਥੇ ਤੁਹਾਨੂੰ ਇੱਕ ਲਿੰਕ ਸ਼ੇਅਰ ਕਰਾਂਗੇ। ਜਿਹੜੇ ਵੀ ਉਸ ਲਿੰਕ ਦੇ ਵਿੱਚ ਆਪਣਾ ਫਿਲ ਕਰਨਗੇ ਉਸ ਲਿੰਕ ਨੂੰ, ਉਹ ਉਹਨਾਂ ਨੂੰ ਸਰਟੀਫਿਕੇਟ ਜਿਹੜੇ ਆ ਉਹਨਾਂ ਦੀ ਈਮੇਲ ਆਈਡੀ ਦੇ ਉੱਪਰ ਪਹੁੰਚ ਜਾਣਗੇ। ਸੋ ਥੋੜਾ ਜਿਹਾ ਕਿਉਂਕਿ ਆਪਾਂ ਟੈਕਨੀਕਲ ਨਹੀਂ ਹੈ ਇਸ ਕੰਮ ਦੇ ਲਈ, ਪਰ ਫਿਰ ਵੀ ਪ੍ਰਮਾਤਮਾ ਦੀ ਕਿਰਪਾ ਦੇ ਨਾਲ ਅਸੀਂ ਇਹਨੂੰ ਕਰਨ ਦੇ ਵਿੱਚ ਕਾਮਯਾਬ ਹੋਏ ਹਾਂ। ਸੋ ਹੁਣ ਮੈਂ ਬੇਨਤੀ ਕਰਾਂਗਾ ਡਾਕਟਰ ਗੁਰਿੰਦਰ ਸਿੰਘ ਵਾਲੀਆ, ਜਿਹੜੇ ਕਿ ਸਾਡੇ ਡਿਪਟੀ ਡਾਇਰੈਕਟਰ ਡਿਵੈਲਪਮੈਂਟ ਨੇ, ਨਾਲ ਡਿਪਟੀ ਡਾਇਰੈਕਟਰ ਫਤਿਹਗੜ੍ਹ ਸਾਹਿਬ ਨੇ, ਕਿ ਉਹ ਅੱਜ ਦੇ ਸਾਡੇ ਪਾਰਟਿਸਪੈਂਟਸ ਨੂੰ ਜੀ ਆਇਆਂ ਨੂੰ ਕਹਿਣਗੇ। There is a question from participants as participants from all over India are joining this webinar, and I think they have one query that what will be the language for this webinar. So our expert will be explaining the entire in English language only. So this is just an introduction part which we are conducting in Punjabi. Otherwise the webinar will be in English. Mostly it will be in English or Hindi. So I would request Dr. Gurinder Singh Walia to please welcome our guest speaker and the dignitaries.
Thank you, Dr. Mandeep. First of all, I would like to thank you for arranging these webinars in a very nice way. And so many people are joining. This shows that we are very successful in our endeavor. Good morning to all those who have tuned in. On behalf of the Director Animal Husbandry Department Punjab, I welcome our guest speaker for today's webinar, Dr. S.S. Randhawa ji, Professor, Department of Medicine from Guru Angad Dev Veterinary and Animal Sciences University. Today's webinar is very apt as the subject is hoof care for field vets. This is very practical aspect. Most of us, we ignore this hoof management. I am grateful that we could gather online amid this COVID pandemic situation and have found a way to connect the veterinary fraternity to discuss this vital practical aspect which we generally are ignoring. I fervently hope that we will all actively pursue such initiatives and hone our skills in this era of technology. Thank you and a very happy Janmashtami. Now I would request Dr. S.S. Randhawa take over the subject. Dr. S.S. Randhawa, please.
A very good morning to all of you. A very good morning.
Good morning, sir.
Good morning, ji. Good morning. And so our topic today is hoof management. So we know that animal stands on hoofs, and hoof management is very important. Why it is important? We know that if we don't manage animal will definitely become lame, and the percentage probability of animal becoming lame if we don't manage the hoofs is probably 60%. So that is very high. So before we go to the directly to the hoof management, we will first talk about what is lameness. So lameness, we can just say that it is alteration from the normal walking. And if we go to any herd and if we see that we can just pursue the animal to walk for 30 or 40 feet, and we can see if animal is not properly walking, we can say animal may have lameness in 1 or 2 feet or maybe more than that. So lameness today is a serious herd problem, and moreover it is more problem on the organized farms. Why? Because most of the organized farm, they select the animals just on the base of production traits, but they forget about conformation traits like feet and legs and other traits like resistance to disease. So more than 90% of bovine lameness, it has been seen that it is due to foot lesions. And if we go to any farm, we can just see the clinical lameness, which we see apparently it is about 9 to 10%. But if we want to, you can say, just inquire what is the full, means what is the proper lameness is there. So we have to trim the all animals, and we have to see that what are the lesions in their feet, and we'll see that more than 40 to 50% animals may have lesions in their feet, and they may become lame in future course of time. So we see this animal is actually having lesions in the heel area. So that is why it is standing in the camp back posture. So you see the animal is just having its hind limbs just behind his body. So that is, it is called camp back posture. So what are the implications of lameness? First of all, this is a very, you can say, great welfare problem, because we cannot judge the pain to the animal when there is any foot lesion or when there is any lameness. So lame cows, they become less competitive because they most of the time they spend more time lying down, so they are liable to be suffer from bad sores. Their body condition score is less, milk production will be less, there's loss of body weight. So another thing is very important is effect on reproduction. We see that most of the lame animals, they become anestric. So because they don't come to the proper time in estrus, so increase in, what is the reason of anestrus is increase in ACTH lead to reduction in LH and alters the manifestations of heat. So inability to mount another cow, that is another thing because of lameness in feet. Then lame cows have negative energy balance. There is reduced secretion of GnRH, LH that are essential for ovarian cycle activity, as the overall cycle, ovarian cycle is disturbed. Then this most of the time lame animals have more problem of repeat breeding. There is pregnancy failure, atrophy of ovaries, lower conception rate. And there was one study in Gadwasu itself that which shows that there is increase in the calving to conception interval at least more than 60 days. And there is low conception rate also at first service, and there is also high incidence of ovarian cyst. And there is, of course, when animal calved, there is low involution of uterus. So these are the implications. And if we see the economic importance of this problem, lameness, we said there is negative effect of fertility, there's loss of milk due to pain, there's loss of body condition score, there is also loss of farmer in veterinary fees, value of time nursing the cow will increase, cost of medication will increase, and there is reduction in the economic life of cow. Most of the time, lame cows by 1 or 2 lactation, they mostly culled from the herd. And First of all, we should understand what is the anatomy of bovine foot. Just see this bovine foot. This is actually, we have cut the digit of the cattle, and we can see that there is pedal bone, hoof capsule is there, and below the pedal bone, very vital thing which is there is corium, which we call dermis also. And this is the only, you can say, vascular part in the foot. And because epidermis is means it is mostly dead part. If we talk about the stratum corneum, it is mostly dead, and just one or two layers of germinativum, spinosum, and lucidum, they are only vital. And the blood supply from the dermis, it comes to the epidermis through diffusion. So that is the only source of nutrition to the epidermis. So just a rough idea about what are the interdigital space, heel, sole bulb. This is a white line, abaxial wall, axial wall, and this is toe area. So we can see this is the overall, you can say, we can divide the different parts of, you can say, healthy hoof. So there is one suspensory apparatus that is a, you can say, is a source of, is a form of connective tissue, collagen fibers, which suspend the P3 bone. P3 bone is just, we have seen in this is P3 bone. We call it pedal bone also. So this is P3 bone. And it suspends from this place by collagen, you can say, fiber band, which we call suspensory apparatus. And it has been said that whenever there is most of the lesions, they are mostly in the freshly carved animals. Why? Because this due to release of relaxin hormone near carving, so there is relaxation in overall muscles of the animal, and there is this collagen fiber, this suspensory apparatus also get relaxed, and the pedal bone sinks down and it presses upon the dermis, and there is problem in the foot or pain in the foot. So there is one digital cushion also, and it is consists of abaxial, axial, and central, three fat cylinders. But the state of this digital cushion is that it acts, of course, it acts as a shock absorber of the pedal bone, but because it is mostly covering the, you can say, hind part of this foot, and just below dermis is just 10%. So that is why it could not protect the, you can say, dermis part, and most of the time there is lameness because of any you can say internal metabolic activity, or maybe due to relaxin hormone, or there are different theories we will discuss in future course. So this is pathogenesis, how it all happens. So there are different predisposing factors like nutrition. Nutrition is very important, and in our India, in our Punjab, we have seen that nutrition has a major role, because we people believe that if we put more of concentrate to the animals, they will definitely give lot of milk. Of course, they will give milk, but they do suffer from lameness also, because whenever there's lot of concentrates we feed to the animal, so they will go to the rumen, and there's again a lot of, you can say, decrease in pH of the rumen, and that pH will changes the overall flora of the rumen, because the normal flora, if we see, there is mostly the 60% gram negative and 40% gram positive. But if there is decrease in pH, there is most of the time there is proliferation of Streptococcus bovis, and there is lactobacilli proliferation. So that is why there's a lot of, you can say, gram positive come in place of gram negative, and there is death of gram negative, and there is production of endotoxins, histamines, amines, different amines, and that they will lead to, due to death of these gram negative, there is production of endotoxins and histamines, and they will go to the, you can say, capillaries of the digits, and they will cause vasodilatation, you can say, constriction, and there is edema in the foot, and that will lead to, you can say, lameness or pain in the animal. So why fodder is important? Because we must feed our animals at least 1/3 of the dry matter of the, you can say, animal should be met from the fodder. Why? Because these animals are ruminants, and ruminants only ruminate when there is fodder is available, when roughage is available. And it has been seen that a normal cow or buffalo, it produces about 200 liters of saliva per day, and saliva is a very good source of sodium bicarbonate, and that will definitely compromise or neutralize the whatever acid if it is produced in the human, so that will save the animal from lameness. So fodder is very important, housing is very important. We keep the animals on concrete floor, if keep the animal in moist area, so that will lead to more of, you can say, lameness. If simultaneously there is some concurrent disease, like if there is astonemia, ketosis, if there is metritis, if there is mastitis, and if there is a retained placenta, all of these diseases will produce endotoxins, and that will cause, you can say, vascular changes, and that will lead to lameness. Genetic influences are, of course, very important. The hawk angle very important, because if the normal, you can say, hawk angle should be, it is just around 170. If it is less than that, or it is quite more than that, that will lead to, you can say, conformational defects, and that will cause animal to become lame. So genetic influence. Another thing is the breed wise, it is very important. We have seen that most of our crossbred animals, they do suffer more as compared to buffaloes. Buffaloes have clinical lameness only in 2%. Sahiwal have clinical lameness, very less animals. But if we see the crossbred animal or exotic animals, they do have more of lameness. Management factors like just housing or rain or other factors, environment, temperatures, they all affect. They cause, if they're more of environment temperature, they cause drying of the foot, and they will have, you can say, more of lameness if animals are kept on the concrete floor. So what is laminitis syndrome? So this, we see, if it, we can divide into different, you can say, parts. First is acute laminitis. Acute laminitis, we see, just see a case of lactic acidosis. In that case, we will definitely acknowledge this acute laminitis, because if it is a case of lactic acidosis, there is a lot of, you can say, animal will take a lot of concentrates, and there is human flora will get changed, and there's death of gram negative, and there's production of endotoxins that will affect the digital, you can say, capillaries. Or other features are heart rate, respiration rate increase, feces liquid, lighter in diarrhea, animals stagger, and some may become recumbent, some may crawl on knees, cross legs, engorgement of superficial veins of limbs. These are all, you can say, characteristics of this engorgement is characteristic of laminitis. Then typical stance, like there's knee bending posture, typical stance, forward or backward, camping of limbs, human pH below, falls to below 5 or just near 5. And treatment is, in this case, mostly we do treatment for lactic acidosis. We give 5%, we can give 5% sodium bicarbonate or 1.3% bicarbonate, depending on the condition. And if it is very, you can say, light one, we can use oral sodium bicarbonate. Another is subacute laminitis. You might have seen a lot of animals in herds having less comfort, means mild discomfort, shifting from foot to foot, and you places a foot on ground very carefully, and there is puffy foot. That is very characteristic. If we see the area of the corium, this is what we call the coronary band area, or if we see the skin around the dew class, that is swollen and pink color, we call it puffy foot. And this is associated with the mismanagement. And most of the time, this subacute laminitis is greater on the farms which have more, you can say, incidence of subacute ruminal acidosis. We call it SARA also. And sometimes, rarely, a groove in the wall of claw some weeks after, because whenever there is time of insult is there, the proper, you can say, nutrition is not up to the mark, to the, you can say, fit, and there is less, you can say, whatever the corium is produced, that is of bad quality, and that will lead to, you can say, break in the, you can say, a groove in the wall of claw, and there's increase in pressure inside the feet causing pain and discomfort. Mostly treatment in this case is mostly oral sodium bicarbonate, or we don't require sometimes treatment, just we have to change the, you can say, our feeding practices. Then the very important is subclinical laminitis. We call it pododermatitis aseptica diffusa, because if we go to any herd and if you come across most of the time in even in 5 to 10% animals, sole ulcer, toe ulcer, or white line disease, you can easily say that this herd is going to have lot of subclinical laminitis. And there are different theories of pathogenesis. First is histamine, endotoxins, role of SARA, local factors, flooring, farm and environment, then animal factors, age, conformation, then there's relaxin hormone we have already, you can say, discussed. Then there are systemic diseases like mastitis, ketosis, astonemia, metritis, udder edema, or this retained placenta, grain overloading. There is definitely role of trace minerals deficiencies also, and zinc, copper, manganese, and cobalt. These are the minor, you can say, micro minerals which are very important. And of course, the biotin is very important. So this is just explanation of that theory, histamine theory. So we can say this nutrition and lactic acid production, decreased pH, death of gram-negative bacteria, endotoxin release, histamine, environment stress, along with the histamine and infectious disease, there is vasoconstriction, laminate destruction, hoof deterioration, and laminitis that will lead to different type of lesions. Another is, this is how, another theory is, whenever there is endotoxemia, there is arteriovenous shunts as produced, because if we see this figure, we can see the most of the time, this is the hoof area, and most of the time there is shunting of blood circulation from one side to another. Just hoof is devoid of any, you can say, circulation. So this will also, you can say, a source of, you can say, when nutrition is not available to the foot and there is not good production of epidermis, and hoof become soft. And this is another theory, and I will like to explain in a very, you can say, another figure in this full theory, simple way. So this is whenever there is, you can say, vascular dilatation, and there is seepage of fluid from the capillaries, and there is edema. That edema will put pressure on the other, you can say, capillaries, and that will lead to ischemia. Ischemia will lead to hypoxemia, and there's tissue hypoxia, and that will lead to less nutrients or oxygen to the epidermal cell or stratum germinativum, or supply to the dermis is also less. Then if there is less of, you can say, supply of nutrient and oxygen to the epidermal cell, there is corium degeneration, and there is basement membrane between dermal and epidermal junction that will get breakdown. So ultimately, if there is dermis or epidermal junction breakdown, there is separation between the stratum germinativum and corium, and this mechanical breakdown, dorsal and side wall laminar support will lose, laminae separate, pedal bone sinks. There is compression of soft tissue between bone and sole. That means corium or dermis is compressed. There is hemorrhage, there is thrombosis, edema, necrosis, scar tissue, and that would ultimately lead to different type of lesions, double sole, hemorrhages, ulcer, diffuse lesions. Then if we see, I want to explain in a just layman language. This is P3 bone, this is P2, and this is epidermis, this is suspensory apparatus, and this is, of course, corium and dermis, and which is the vascular part only. And whenever there is vasodilatation or vasoconstriction, there is permeability of these small capillaries will get increased. and there is lot of fluid will come out from the capillaries. Lot of fluid will come out from the capillaries, and there is edema in the foot. That edema will cause, you can say, pain in the foot because there is pressure in the foot, and that will also lead to ischemia. Ischemia means pressure on the other capillaries, and that will block the other capillaries, and there is, you can say, cut off of the nutrition to the foot, and there is you can say hindrance to the production of good, you can say, stratum corneum or good epidermis, and that will ultimately lead to lameness. So we have also seen that there is lot of chances of lameness, they increase just after calving. So we can see this is a graph showing this is 4 months before calving, 2 months before calving, and 0 is showing the at calving. So you see the incidence is very much increased, and it remained up to 2 months after calving also. And there is then we talk about chronic laminitis. There are very few cases which do suffer from chronic laminitis, but in those cases there is dorsal wall flattens and become concave, sole widens, so does the white line. Sometimes apex may get break off, and mostly it is the lateral claw of the hind feet which is suffered and medial claw of the forefeet. Then it is never proved that it is due to repeated episodes of laminitis, but we have seen that in those animals, laminitis or lameness episodes repeatedly occur. They do suffer from this type of chronic laminitis. And most of the time, if we trim the animals, they again grow. So this is the place where we have to think upon that we have to select those animals for breeding or not. So we have to call these type of animals. So now coming to the diagnosis in this case is very important. So first of all, we have to see what type of, you can say, these are some clues by which we can see that whether animal is lameness. When you go to any farm, you just see, first of all, you just let the animal to walk for at least 40-50 feet, and you just see these 4-5 things. Just see that animal top line is flat, not hunchback, not hunchback. Then second thing you have to see is the joints flex equally. Then one leg, it is not stiffer than others. So animal is not keeping one leg stiffer than the other. Then another thing is tracking back. So this tracking back is where the animal will pick its front feet, the hind foot will be placed on that very point. So it is tracking up. So if it is there, that means animal have full flexibility. There's another thing is there should not be no head bobbing. Head bobbing means up and down movements of the head. There should be no limping, no reluctance to bear weight. So these are the 5 things we can see when we go to the, you can say, any farm, and we have to see the lameness. Then this is the normal gait. This has protection phase when the animal lifts, then weight bearing phase when keeps its foot on the ground, and retraction phase when it will go like on the back side, and fit will go to the back side. So that these are the 3 things we have to check in the normal gait. And if a normal cow walks with a level spine and places her feet almost exactly on the same spot as the forefeet, that means this animal is very good, and this is not going to become lame in just future course of time. So if we go for the lameness scoring, there are different lameness scoring systems overall in the world. So just we can use this simple one also. So score 0 we give to the no gait of normality visible at walk. Then score 1 mild lameness with variation from the normal gait. Just symmetry, gait symmetry. So most of the time we have seen that in our crossbred animals, most of the animals, means about 50-60% animals, they do have some asymmetry after first calving. So after calving, most of the animals, they have light asymmetry at walk. So we can call it is just score 1. Then score 2 is moderate lameness with moderate and consistent gait asymmetry. If you are seeing that animal is putting more pressure on the one limb, and score 3 is severe lameness with marked gait symmetry or severe symmetric abnormality. And mostly we cover this score 2 and score 3 in the clinical lameness, and score 4 is the non-ambulatory or recumbent animals. So we have to see animals on a, you can say, concrete, firm and non-slippery surface from each side, from front and behind, then standing quietly and also on walking. Then we can see this way lameness score 0 is there, lameness 1 is there, lameness score 2 is there, and lameness score 3 is there. And when the animal go from the lameness score 0 to, you can say, 3, definitely its body score is going to decline. Then this is a lameness score 3 animal, which we have already seen. So now see, this is also, there are different types of stances animal will take when there is pain in the animal. So cattle will reluctant to rise on the forelimbs when there is acute lameness. Then there is hanging leg lameness. Whenever there is any fracture or whenever there is septic arthritis of the pedal bone, so or fractured pedal bone, or maybe fracture on the any part of limb, and you will try to keep the limb hanging. So we can easily judge, we can just take an idea that whenever there is hanging leg lameness, there's definitely animal may have fracture, So then another thing is walking narrow. This animals mean having more of, you can say, lesions or more lesions in the medial class. That is why putting more weight on the lateral class. So another is knuckling of the feet. And if there is any, you can say, nerve problem is there, animal may have knuckling. Then this is crossing either fore or hind feet. This acute pain, mostly whenever there is lameness in the lateral class, animal will shift weight to the medial class. So this is posture, how animal shift weight. And this is another, that whenever, most of the time, hind limbs, they suffer more on the lateral side. So that is why animal shift its weight on the, you can say, middle class. And you see, this is cow-hawk posture. When the hocks of the animals, they get, you can say, bent towards the medial side, we call it cow-hawk posture. So this is camping back, just like we have already seen another. Whenever there is any problem in the heels, animal will move its feet behind the body and shift its weight more on the toes. So that is called camping back posture. So we can also, we have recently used this sole thickness also. We can measure on any firm sole thickness by ultrasonography. This is just a cadaver sample. We have standardized this technique. This is how we can see go for the ultrasonography. And by ultrasonography, we have seen there's a lot of difference between the lame animals and non-lame animals in the sole thickness. So in lame animals, sole thickness very much get decreased. So this is sole thickness. We can say, we can see the distance from this bone area, pedal bone, and this is sole thickness. This is from the this is the epidermis, you can say, thickness, and this is full, you can say, measurement from the pedal bone. So we can also see that also. So from that also we can judge how much is the thickness of sole. So this is how we can see our lame animals, that there is, if there is requirement of trimming or not, or whether if there is repeatedly these animals suffer from the lameness, whether we have to take these animals for breeding purpose or not. Then definitely there is role of acute phase proteins like CRP, haptoglobin, fibrinogen, serum amyloid A. So they all increase in the lame animals. So this is a figure in the lame animals, they all increase. Then there is definitely there is different in the sole thickness also. Sole thickness, they decrease from the time of calving to the 110th day, or with the you can say moving of the calving period, the sole thickness will get decreased both in lame animals and non-lame animals. So we have seen this, if we have compared lame and non-lame animals, so there is increase you can say thickness in the non-lame animals, but in lame animals, their thickness is very less. And the normal thickness we require very good for any animals, normal epidermal thickness we require is about 7 mm millimeter. So this is the things we can use for the hoof trimming. This is a simple, you can say, hoof cutter. This is hoof rasper, hoof platter. These are hoof knives. So we can use this for hoof trimming, and we can even we can say the farmer to get its animals every semesterly to go for the hoof trimming. So then before we go for the hoof management, just I will explain about different lesions we will come to acknowledge with the subclinical laminitis or clinical laminitis. So we see the heel erosions. These are very important. You see this animal, this figure, the whole, you can say, the heel is, we can say, heel is destroyed. And mostly heel acts as a shock absorber. So animal will shift its weight on the toes, and that there may be growth of toes also after some time. And there's another picture we see there's sole hemorrhages. Then sole ulcer is there. So this is mostly in the sole bulb area. So this is very pain causing lesions. There are two lesions which are very important, which cause clinical lameness in animals. And that is, one is sole ulcer, another is white line disease. I will show white line fissure also. I will show you that one. This is toe hemorrhage. There can be sometimes, if it is not treated, there can be some ulcer also develop at this place. And then this underrunning of sole, and this is one sole and this is another sole, and in between there is dung. So this means the normal sole will get divided into the two parts by dung, you can say, partition. So this is double sole. You might have seen in most of the cases which suffer from FMD, after some time they do have like this double sole. And this is white line. White line is having hemorrhage. You see this hemorrhage is there, and this is white line hemorrhage, and this is a fissure. Now white line is the area which binds the solar epidermis and the lateral epidermis and keeps the horn or hoof in a very compact position. So that you can say overall, you can say it is a force to bind the both sides, solar or parietal, both surfaces. So now if this is destroyed, anything from the, you can say, environment, from the underfoot slurry, you like nails or like any wooden pieces, any stones, they might migrate in this white line, and that may go to the, you can say, the junction between or joint between the P3 and P2, which we call coffin joint, and there that may lead to arthritis, and that may destroy your animal, you say, productivity. So now this is another thing, that is sole avulsion. In this case, we have seen that if we curate this and this area, there is powdery, you can say, sole is there. So this is because this is mostly we have seen on those farms where there is not proper, you can say, feeding of mineral mixture, regular feeding of mineral mixture is there. That means sole is not fully developed. Sole is not fully developed, and this is overgrown sole. And this thing also sometimes lead to the lameness or clinical lameness in animals, because this may grow like this, and this may shift, the animal may shift weight to the, you can say, there is cow hog posture, and there is shifting of weight, and the animal will walk like a lame animal, totally lame animal. And when we trim these animals, proper trimming is there. Just after trimming, we have seen miraculously these animals get cured immediately. This another is, this is cut one slipper foot. Mostly slipper foot is most common in buffaloes. Overgrown hoof is very common in buffaloes, and this is corkscrew hoof. Corkscrew hoof is very common in cattle also. It is of course very common in Sahiwal cattle also, and it is also common in buffaloes also. So these are the mostly lesions with the chronic laminitis. And other lesions are like when if animal becomes sick at any course of time during the lifetime. So whenever during that time, whatever hoof is produced, that is of not proper quality, and there is sometimes horizontal fissures, and these are the vertical fissures. So there are some, you can say, people say there is some deficiencies also, and we have seen in some cases one farmer was feeding selenium, you can say, added mineral mixture, selenium supplemental mineral mixture, and from that farm we have acknowledged these type of problems, vertical or this horizontal fissures. Then type of skin lesions. Of course, these lesions are less in our farms, our herds, but they do have very important significance. Another one is foot rot. Foot rot is mostly due to fusobacterium necropharm. These are normal commensal in the animal's human, and it is present in the ciliary also. The interdigital portion of the this uh, interdigital portion of the foot will get you can say affected, and slowly there is swelling of whole of this area, and there is, we call it interdigital phlegmon also, and animal in this condition could not walk also. So another thing is interdigital dermatitis. Dermatitis is just, you can say, whenever this FMD starts, mostly first it will start with the interdigital dermatitis or just inflammation in the interdigital space. Another thing is digital dermatitis. This is an infectious one, and mostly it is associated with the treponema spirochetes, and mostly ulcerative lesion on the back side of the means behind the, you can say, just above the heels, just in the skin area. So we can use different type of sources like copper sulfate or another mixtures for treatment of these cases. Then this is interdigital skin hyperplasia. This is very common in heavy animals. Whenever there is any, you can say, it is very common in breeding bulls also. When they mount on the dummy and their toes, both of the toes get supplayed, and this pressure in this area, and slowly skin will get, you can say, overgrown in this area. We call it interdigital hyperplasia. Then how we go for the management. So management is very important, because most of the time our farmers think that there is no need of hoof trimming in our animals if there is no lameness. But just like us, when we also cut our nails every week, so we have to go for hoof trimming in animals every 6 monthly, at least every 6 months. First thing is functional claw trimming. That is very important. How we have to go for that? First thing is restraint of animals. That is very important. We have devised but this is not so strong. We can make this, you can say, uh, this jute. We can make good one also. So this is, they have used pipes, but it should not. It should be hard. You can say rods should be there, and so we can hold the animal's hoof like this. So there's a very good using the jute. So we can make some jute like this. So these are the, you can say, belts we can put under the belly of the animal, and we can keep the animal in full state. So when we go for the functional hoof trimming, we have to first thing keep in mind, we have to stable the, you can say, longitudinally the hoof. We have to stable hoof the longitudinally. How we'll stable the hoof longitudinally? We mostly seen that the toe area become more thickened in lame animals, and we have to trim the toe area, so that the overall length of the, you can say, hoof will get balanced. There is equal balance of load on the claw between the anterior and posterior halves of the claw. So cut the tip of hoof. Just see this picture. If we see animal when there is growth of the animal, this angle between the upper and the dorsal and the solar wall, that will get acute, and we have to maintain this angle at least about 45 degree. So we have to cut or reduce the thickness of the toe first of all. So cut the tip of toe, then remove excess sole and ball from the beneath the anterior half the glove. So this is how we first of all just short the length up to the, if we trim the hind claws, suppose if we are trimming hind claws, lateral claws are mostly grown, and we have to keep this middle claw as a guide. So we have to reduce the length of lateral claw to just equal to the length of medial claw. So then this thing, after this thing, we have to reduce the, you can say, horn tissue from the toe area. So when this will get done, then another thing we have to go for the lateral stability. So lateral stability, because most of the time one hoof is very much overgrown and medial claw is mostly very less grown. So we have to reduce the, you can say, horn tissue from the lateral side. So to transfer more of the weight from the lateral side to the hind, to the medial claws in hind feet, and from the medial to lateral claws in front feet. So we have to reduce this area. So this is the cutter, this is a knife we are using. So we have seen that now it is just equal, and we have to reduce this. If there is any, you can say, this white line fissure is there, we have to open this area, because if we leave it, so this will further increase. So if we'll open it, that will get immediately healed. So overall purpose is to transfer partially the load of overburdened lateral hind claw to the medial claw. And then another thing is, we have to make the axial wall concave. So you see your feet, our feet is also concave from the medial side or axial side. So we have to make the concave feet from the medial side or this side. This is the axial side, this is abaxial side. So we have to make the hoof concave from the medial side or axial side. So this is functional hoof trimming. Another is corrective hoof trimming, where we reduce this area. That is, we have to remove this white line fissure like this. Then sometimes we use this blocks. Not here in India. Most of the time in the Western countries they use blocks, because in our side adhesive is not you can say available of good quality. So we have not used blocks till date. So we can use in future also, because a lot of the international companies are now coming. So we can apply it in the, you can say, healthy hoof. If it is in the hind feet, we can apply it in the medial claw, because medial claw is healthy. So we can apply it on the medial claw and shift the weight of the animal on the medial claw. And if there is sole ulcer on the lateral claws, we can go for the dressing of that sole ulcer. So this is another thing we have used, soda bicarb or magnesium oxide, both this buffers, and along with buffer plus zinc. And we have seen there's a lot of difference in different type of severity of lesions, different lesions that will get reduced. Just so another thing we have used, that in sole ulcer we tried the simple mixture. This simple mixture is of copper sulfate and zinc sulfate in 1:1 ratio, and this is easily available mixtures, as we can use this powder in 1:1 mixture and just go to the sole ulcer area and just clean it and fill that area with this this mixture, and just put a very light, you can say, bandage. And this bandage you have to change every 5th day, and just you see in five bandages you will see miraculous, you can say, improvement is there, and the sole ulcer get healed. This is just pictures over 25 days, and every 5 days we change this, and sole ulcer they get easily healed. So that, because there are a lot of, you can say, properties of these copper sulfate and zinc sulfate. Copper sulfate, it improves the angiogenesis, means capillary formation in the, you can say, tissues. So that will help in the, you can say, generation of the new epidermis, healthy generation of the new epidermis. So another thing very important is, besides trimming every 6 monthly, second thing we have to advise to the farmers is foot baths, because we have nowadays very good, you can say, organized farms having 200, 400, 500 animals, and on that farms you must say that there is should be erection of these foot baths. One is clean water bath, another is bath for the, you say, medicated bath. So you have to devise these two baths, and in between baths there should be some area about 10-15 meters, so that animal, whatever the water is attached to the feet of animals, that will get, you can say, dried. So these are two baths. One is fresh water, another is medicated, and this is bath should be 3 meter long, 1 meter wide, and 15 centimeter high. So in that bath, that should be concrete baths, and you can, these are the, you can say, tried one, and this is internationally accepted formula. We are my research is there in this area. So formalin, you can put just the normal formalin which is available in the market, that is 39-40%, but we can take it 100%, and we can put 120 liters of water in that, you can say, bath, or 5 liters of formalin, just if you have 200 animals. And those animals, they must walk from the foot bath on first, second, third day of every fortnight. Means you have to use this mixture continuously for 3 days, same mixture for 3 days, and you can again make the new mixture after every fortnight. So this will treat your 200 animals, 150 to 200 animals. And if there are farmers which are having, you can say, less number of animals, to them you can say, you can use foot sprays, and you can use 40 ml of formalin in 1 liter of water, and this is 4% spray. And similarly, you can lift the foot of animals, just give a spray to the on the solar side, and keep the fit back. Then these sprays you have to use on same first, second, third day of every fortnight. You can advise to the farmers which are having less number of animals, or 4 or 5 animals. So then after foot bathing, at least these animals should stand on some pakka floor at least for half an hour or 1 hour. So that will be good, because this medication will get full time to act upon. Then another thing very important is, third thing is balanced nutrition. So this is very important, because first thing we have to keep in mind is we have to just think about the concentrate fodder ratio also. At least 1/3 of the dry matter of the animal should be met from the fodders, and 2/3 from the nutrition. And nutrition also, you have to take the advice of our nutritionist regarding that, and that my animal is giving so much milk, and how much nutrition or how much concentrate I should give to the animals. Because most of the time we take a formula like, if our animal is giving 10 kg of milk, if it is a cow, and we give just, you can say, for every 2.5 kg milk, we give 1 kg concentrate. So means if it is animal is having 10 liters of milk, we give 4 kg of concentrate plus 2 kg of for maintenance of the animals, 6 kg overall. So similarly, we can say if animal is giving 40 kg, there's need not to give so much, you can say, mixture. You should take advice from our nutritionist, and you should prepare your own diet according to the need. Another thing very important, we have seen in our trials also, that most of the people in villages, they grind this wheat, and every time when they milk the animal, they mostly use this grounded wheat, or you can say just flour also. So that is very, you can say, toxic. In any case, if grounded wheat or wheat increased above 5% in a, you can say, feed, then it is going to become, you can say, cause disturbance to the animals. A human pH will get decreased, endotoxemia will be there, and there are a lot of chances of, you can say, this lameness. And also another thing is very important, is another is mineral mixture. You have to advise to the every farmer that regular feeding of mineral mixture is very important to keep their animals in, you can say, proper stage of reproduction, proper stage of production, and also for good hoofs also. And if, in addition to that, if you come acknowledge again problem of nutrition, this lameness on those farms which are already feeding this mineral mixture, you can advise on those farms this biotin and zinc salts. These are very important. Where biotin is important, because if we, you can say, critically watch the, you can say, epidermis, this is mostly consists of keratinocytes, and these keratinocytes, they are interspaced with the intracellular cementing substance, and this intracellular cementing substance, this is mostly formed of neutral lipids. Keratinocytes are of course proteinaceous part, but this intracellular cementing substance consists of neutral lipids, and that neutral lipids, and that means good lipids, they are produced with the biotin. Because whenever there's a lot of decrease in pH in the rumen, these type of biotin and other a lot of vitamins which are produced in the by microbes in the rumen, they are not produced, and they say become deficient in animals, and there is, you can say, deficiency of, you can say, lipogenesis also, not proper lipogenesis is there, and then you can see that there's a lot of lameness in those animals. And zinc, on the other hand, it helps in the, you can say, keratinization of the hoof. It helps in the, you can say, very good management of, you can say, good hoofs. So on those farms, instead, if you are feeding mineral mixture, again, you are acknowledging this lameness on those farms, you can advise biotin. Biotin, we can put just 20 milligram per animal per day. Or we have seen that most of the mixtures available in the market, they are a poultry biotin. They have 2% of poultry biotin. So this is very costly. And you can give just 1 gram of 2% biotin powder. So that will contain 20 milligram of biotin. And along with that, you can advise zinc sulfate 4 grams, zinc oxide 2 grams, or means either zinc sulfate 4 grams or either zinc oxide 2 grams. So this will definitely, if you advise for 2 months or 2.5 months, your animal will get immediately cured after 2 months. They have very good hooves. So 3 things very important is, one is we have to regularly foot bath the animals, regularly trim the animals every 6 monthly, and we have to balance our nutrition also. That is very important. Now coming to conclusion, if we see about that, about 20% of culling in animals is due to lameness. So we have to think critically. So, and selection of the, you can say, animal should be on the good conformation also along with the production. So do regular hoof trimming, use hoof paths, provide sufficient space, soft bedding to the animals. This soft bedding is very important, because some of the, you can say, this farms in the city area, they have only concrete floor. So at least 8 to 10 hours soft bedding area or paddock is very important for every animal. So we have to provide animal this soft area for at least 8 hours, 8 hours, and sufficient space. This is also very much particular with related to the city farms, because in the cities mostly they have the space for 50 animals and they have 80 animals on that area. So and most of the weak animals, they keep on standing for 24 hours, and that will increase more chances of lameness in those animals. So give adequate fodder to your animals, think about lameness, pain to your animals. So always remember hoof management. Thank you very much. If you have any question, I'm there to answer you.
Thanks, Dr. Randhawa, for very informative session. So if you have any queries, please send your queries in your chat box. If you have any queries, please send your queries in chat box, or you must simply raise your hand. Haji Dr. Pannu, please unmute yourself.
Good morning, sir.
Good morning, Pannu.
Sir, first of all, thanks a lot for wonderful session on hoof. And we learned many things, already learned 7 years back in training from you. And
Okay.
my first question is, what is the treatment of interdigital skin hyperplasia?
So very good question. Most of the time, whatever advised is they mostly use cryotherapy, means liquid nitrogen. They cut, or thermotherapy, you can say. They use heat to cut that portion. But most of the animals' pain with that is very much, and mostly animal could not tolerate. And in that case, you can I will advise, if there is maggot infestation, biologically we can remove that area. If there is maggot infestation, keep a watch on the animal. And if these maggots, they just proliferate in that area, and they just remove that hyperplasia, and simultaneously you have to keep a watch. And when the whole of the mass is removed, you can just dress that area with just simple zinc sulfate. So that will definitely cause, you can say, cure in that animal.
Sir, one more question. How much time you advise animal on kacha and pakka floor? Like in 20?
At least 8 hours you must give to every animal kacha floor, because animal, you'll see animal will relish on that area. And if you keep your animals 24 hours on this pakka floor, concrete floor, so that will be definitely not, you can say, even there may be something like a production increase also if you keep the animals on. If we give the buffaloes to wallow in the water, so they increase, they have their milk production increased. So this is just like that. If we just shift the animal for 8 hours to the kacha floor, they will definitely relish it, and there's definitely some, maybe insignificant, there will definitely increase in production also.
So there are a lot of queries. First, I would like to say that if anybody, all those participants who are interested in getting participation certificates, I have shared the link in this chat box. So please fill in the feedback per forma. Only then you will be eligible for your participation certificate. Link for filling feedback per forma has been shared in the chat box. So please fill in the feedback per forma, so you will be eligible for the certificate. So there's some questions.
Welcome.
What is the treponema for differential diagnosis?
That we have to just go for the, you can say, take the sample and go to the lab. So, but we, on the basis of lesions, we can see it is digital dermatitis. We call it digital dermatitis. This is mostly problem of Western countries actually, where there's a lot of cold environment and this moisture is there, a lot of moisture is there. But I have gone from, through very large number of animals, 2,000, 3,000 animals. But in our Punjab, we have acknowledged just 1 or 2 cases. So this is very less problem in our area. So, but in that case, if you come acknowledge, you have to give oxytetracycline foot bath also. So you can use oxytetracycline powder. You can put 6 grams per liter, and that make a, you can say, foot bath, and or spray. You can go for the dressing also. and you can go for this cure treatment of that case.
How to diagnose which hoof of the animal is faulty?
Which?
Hoof of the animal is faulty.
Yeah, when you go for the, you can say, lameness scoring, you can easily pinpoint that on which hoof animal is putting more weight or which leg is stiffer. So you can easily pinpoint that this animal is having a problem in this fit. So by lameness scoring, you can just diagnose that. But the definite diagnosis will go for, if you go for the hoof trimming, then you can make sure, because sometimes animal shifts its weight to the other limb, and so we can judge only on the trimming. So most of the time it is on the trimming, you on the basis of scoring, you can judge that this limb is going to get affected.
Can we feed sodium bicarbonate 50 gram daily to a 600 kg lame HF cow?
We can feed, or you can just advise the farmers to put 1 kg of sodium bicarbonate in 100 kg of feed. So in overall feed, we can just use that buffer, or sometimes it is good to, if we add this 750 grams of sodium bicarbonate and 250 grams of magnesium oxide. So that is another thing we can use.
So now, what is the role of sulfur in lameness? And another question is, can we use rubber tire flats as hoof support?
Just one question. First thing is, what is the role of sulfur?
Yes.
So sulfur, we know that it is there is disulfide linkages between different amino acids to make a protein. So everything in body is depending upon the sulfur. A lot of ways depending upon the sulfur. So copper is very important. Zinc is very important. So these all make, means first of all, the skeleton of the hoof is made with calcium and phosphorus, and the, you can say, refining, or the, you can say, polishing of the hoof is done by all these micro minerals like sulfur, copper, this manganese, cobalt, zinc. Another question?
Can we use rubber tire flats as hoof support?
Rubber tire
flats as hoof support.
For as blocks?
Hoof support, ਪੈਰਾਂ ਦੇ ਥੱਲੇ support ਦੇਣ ਲਈ ਕਹਿੰਦੇ ਵੀ ਰਬੜ ਦੇ ਟਾਇਰ ਲਾ ਸਕਦੇ ਆ ਜੀ.
I could not understand your question. Just explain me.
Can we use rubber tire flats as hoof support?
You are you want to replace in place of this blocks, or just only without any reason, means in the healthy animal you keep on using, and you just want to say it like that?
I think it's a question from some participant. I am not clear what you want to say. So let's take
so
next question.
Ask the participant to just ask. What was that?
Let's take the next question. For trimming, is there any nerve block needed?
There is no need of any nerve block. So this is a simple procedure, and just restraint is very important. So nowadays, if we go for the from the Western countries, there are different discs are available, motorized trimmers are available. So we can use that also. So we can use manual trimming also. So there is no need of any block.
Is it always recommended to give a selenium-free mineral mixture in hoof problems?
In Punjab, there is no need to feed selenium, because in Punjab, 1 or 2 areas are already excessive in selenium. So there is no need of selenium supplemented mineral mixture in Punjab. So already whatever the selenium we get from the fodder or other things, that is sufficient. So there is no need to feed selenium.
Is it compulsory to feed green fodders to the animals?
Yes, of course. This is very important. And we have seen that if you don't properly, we have gone to some herds or farms where people are feeding ad-lib concentrate in the mangers. Ad-lib concentrate and loose housing system, and cattle can come anytime and take any amount of, you can say, mineral mixture, this concentrate. So in those farms, when we trim those animals, at least 10% of the animals are clinically lame and having sole ulcer in both feet, both hind feet. So there's a lot of problem. Concentrate fodder ratio, it is very important. If you don't feed the concentrate, that will go good with the normal, you can say if it is 5, 6, 10 kg animals. But if we don't feed the fodder, so that will going to down the production of that.
Next question is, what is a substitute of wheat for concentrates?
Substitute of?
Wheat.
This a lot of other grains are available. Maize is there, oats are there. A lot of other things are available. So we recommend mostly maize. Maize is very important. Maize you can put. You can put oats also. You can put other bajra is there. So jaw and wheat. These are we don't recommend so much. So if you want to put wheat, just put up to 5 kg, not more than that, in 100 kg.
How to apply zinc sulfate culture, whether dry or to be mixed with paraffin or something else?
Pardon?
Zinc sulfate culture. How to apply zinc sulfate culture? I think copper sulfate, he must be writing copper sulfate. Whether it should be dry or mixed with paraffin.
Where?
For the hoof.
Sole ulcers.
Yes,
Sole ulcers. We use 1:1 ratio of copper sulfate and zinc sulfate. And you can just simply make a mixture. Even you can, when you curate that sole ulcer area, that is somewhat wet. And if you just fill that area, just fill the dry powder in that and just apply a light bandage so that weight could not be shifted. Weight of the animal will not shift. Should not shift. So just apply the light bandage and just a dry mixture you can just put in that sole ulcer.
Dr. Pannu, please switch off your mic, please.
WhatsApp.
Dr. Pannu. So can we use mats instead of providing kacha floor?
This is not an alternative. This is not an alternative. These are practices which the modern world is going to do, but there is no substitute of kacha floor. There is no substitute of kacha floor. Mat I have seen, they do, you can say, purpose, they do solve some purpose, but not up to the level where the kacha floor is doing.
I think we are beyond our time. So now I would again request all the participants that I have shared the link for feedback in this chat box. So all those who are interested in getting participation certificates, they are requested to fill in the feedback per forma. So all the certificates will be issued on the basis of this feedback per forma. Now I would request Dr. Sarabjit Singh Randhawa, President Punjab Veterinary Council, to please come and share some words with us.
Thank you, Dr. Mandeep. ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਮੈਂ ਸਾਡੇ ਸਤਿਕਾਰਯੋਗ ਵਾਈਸ ਚਾਂਸਲਰ ਗੜਵਾਸੂ ਡਾਕਟਰ ਇੰਦਰਜੀਤ ਸਿੰਘ, ਡੀਨ ਕਾਲਜ ਆਫ ਵੈਟਰਨਰੀ ਸਾਇੰਸਜ਼ ਡਾਕਟਰ ਪ੍ਰਕਾਸ਼ ਸਿੰਘ ਜੀ ਬਰਾੜ, ਇਹਨਾਂ ਦਾ ਧੰਨਵਾਦ ਕਰਨਾ ਚਾਹੁੰਦਾ। ਇਹਨਾਂ ਨੇ ਸਾਨੂੰ ਇਹ ਵੈਬੀਨਾਰ ਅਰੇਂਜ ਕਰਨ ਵਿੱਚ ਕਾਫੀ ਕੰਟਰੀਬਿਊਟ ਕੀਤਾ। ਉਸ ਤੋਂ ਬਾਅਦ ਸਾਡੇ ਅੱਜ ਦੇ ਗੈਸਟ ਸਪੀਕਰ ਡਾਕਟਰ ਐਸ ਰੰਧਾਵਾ, ਉਹਨਾਂ ਦਾ ਬਹੁਤ ਮੈਂ ਸ਼ੁਕਰਗੁਜ਼ਾਰ ਹਾਂ ਆਪਣੇ ਇੱਕ ਸਮੂਹ ਕੇਡਰ ਵੱਲੋਂ, ਜਿਨ੍ਹਾਂ ਨੇ ਸੰਡੇ ਇਹ ਛੁੱਟੀ ਵਾਲਾ ਦਿਨ ਹੋਣ ਦੇ ਬਾਵਜੂਦ ਵੀ ਆਪਣਾ ਕੀਮਤੀ ਟਾਈਮ ਕੱਢ ਕੇ ਸਾਡੇ ਵੈਟਰਨੇਰੀਅਨ, ਸਾਡੇ ਫਾਰਮਰਸ ਨੂੰ ਵੈਲਿਊਏਬਲ ਇਨਫੋਰਮੇਸ਼ਨ ਦਿੱਤੀ ਹੈ। ਸਾਡੇ ਬੜੇ ਸਤਿਕਾਰਯੋਗ ਡਾਇਰੈਕਟਰ ਸਾਹਿਬ ਡਾਕਟਰ ਗੋਪਾਲ ਸਿੰਘ ਜੀ ਵਾਲੀਆ, ਜਿਨ੍ਹਾਂ ਨੇ ਸਾਨੂੰ ਇਸ ਵੈਬੀਨਾਰ ਵਿੱਚ ਜਿਹੜੀ ਵੀ ਅਸੀਂ ਉਹਨਾਂ ਨੂੰ ਹੈਲਪ ਦੀ ਜਾਂ ਕੋਈ ਮਦਦ ਦੀ ਲੋੜ ਉਹਨਾਂ ਕੋਲ ਡਿਮਾਂਡ ਕੀਤੀ ਆ, ਉਹਨਾਂ ਨੇ ਪੋਜ਼ਿਟਿਵਲੀ ਸਾਨੂੰ ਇਹਦੇ ਵਿੱਚ ਬਹੁਤ ਜ਼ਿਆਦਾ ਕੰਟਰੀਬਿਊਟ ਕੀਤਾ। ਉਹਨਾਂ ਦਾ ਵੀ ਮੈਂ ਬਹੁਤ ਸ਼ੁਕਰਗੁਜ਼ਾਰ ਹਾਂ। ਤੇ ਖਾਸ ਕਰਕੇ ਡਾਕਟਰ ਮਨਦੀਪ ਸਿੰਘ ਜੀ ਤੇ ਉਹਨਾਂ ਦੀ ਟੀਮ, ਜਿਹੜੀ ਕਿ ਇਹ ਸਾਰੇ ਵੈਬੀਨਾਰਸ ਦੀ ਬੈਕਬੋਨ ਨੇ। ਬਾਤ ਕਰਦਾ
ਤੁਹਾਡੀ ਆਵਾਜ਼
ਲੌਂਗ ਟਾਈਮ ਸਾਡੇ ਡਾਕਟਰਸ ਨੇ ਵਿਭਾਗ ਨਾਲ, ਯੂਨੀਵਰਸਿਟੀ ਨਾਲ ਮਿਲ ਕੇ ਐਕਸਟੈਂਸ਼ਨ ਵਿੰਗ ਨੂੰ ਮਜ਼ਬੂਤ ਬਣਾਉਣ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਆ, ਜਿਹੜੀ ਕਿ ਬਹੁਤ ਹੀ ਵੈਲਿਊਬਲ ਪਾਰਟ ਆ ਸਾਡੇ ਡਿਪਾਰਟਮੈਂਟ ਦਾ, ਜਿਹਦੇ ਵਿੱਚ ਅਸੀਂ ਬਹੁਤ ਪਿਛੜ ਗਏ ਸੀ। ਉਹ ਮਨਦੀਪ ਸਿੰਘ ਦੀ ਟੀਮ ਨੇ ਡਿਪਾਰਟਮੈਂਟ ਨਾਲ ਰਲ ਕੇ ਇਹ ਬੀੜਾ ਚੁੱਕਿਆ। ਬਹੁਤ ਹੀ ਖੁਸ਼ੀ ਦੀ ਗੱਲ ਆ। ਮੈਂ ਕੱਲ ਇੱਕ WhatsApp ਗਰੁੱਪ ਤੇ ਵੇਖ ਰਿਹਾ ਸੀ, ਉਹ ਡਾਕਟਰ ਪੰਨੂ ਦੇ ਨਾਲ ਸਾਰੇ ਮੈਨੇਜ ਕਰ ਰਹੇ ਨੇ। ਬੜੀਆਂ ਵੈਲਿਊਬਲ ਇਨਫੋਰਮੇਸ਼ਨ ਉਸ ਗਰੁੱਪ 'ਚ ਮਿਲਦੀਆਂ ਸੀ। ਮੈਂ ਸੋਚਦਾ ਵੀ ਸਾਨੂੰ ਆਪਣੀ ਨੌਲੇਜ, ਫਾਰਮਰਸ ਨੂੰ ਆਪਣੀ ਨੌਲੇਜ ਅਪਡੇਟ ਵੀ ਕਰਨੀ ਪਏਗੀ ਤੇ ਫਾਰਮਰਸ ਨੂੰ ਉਸ ਨੌਲੇਜ ਨੂੰ ਡਿਸੈਮੀਨੇਟ ਕਰਨਾ ਪਏਗਾ, ਜੇ ਅਸੀਂ ਫਾਰਮਰਸ ਦਾ ਦਿਲੋਂ ਭਲਾ ਚਾਹੁੰਦੇ ਹਾਂ। ਕਿਉਂਕਿ ਮੈਂ ਪਿਛਲੇ ਇੱਕ ਵੈਬੀਨਾਰ ਜਿਹੜਾ ਟੈਕਸਟ ਤੇ ਹੋਇਆ ਸੀ, ਆਲਰੇਡੀ ਮੈਂ ਮਨਦੀਪ ਜੀ ਨੂੰ ਦੱਸ ਚੁੱਕਾ ਕਿ ਉਹਨਾਂ ਦੀ ਮੈਂ ਪ੍ਰੈਕਟੀਕਲੀ, ਡਾਕਟਰ NK ਜੀ ਜਿਹੜੇ ਪੈਰਾਸਟੋਲੋਜੀ ਵਾਲੇ ਸੀ, ਮੈਂ ਇੱਕ ਫਾਰਮ ਤੇ ਪ੍ਰੈਕਟੀਕਲੀ ਅਪਲਾਈ ਕੀਤਾ ਤੇ ਓਨੈਸਟਲੀ ਸਪੀਕਿੰਗ 90% ਮੇਰੀ ਉਹ ਪ੍ਰੋਬਲਮ ਆ ਉਹ ਹੱਲ ਹੋ ਗਈ ਆ। ਸੋ ਇਸੇ ਤਰ੍ਹਾਂ ਜੇ ਅਸੀਂ ਆਪਣੀ ਇਹਨਾਂ ਵੈਬੀਨਾਰਸ ਦੇ ਰਾਹੀਂ ਨੌਲੇਜ ਗੇਨ ਕਰਕੇ ਇਹਨੂੰ ਫਾਰਮਰਸ ਤੱਕ ਪਹੁੰਚਾਵਾਂਗੇ ਤੇ ਜਿਹੜਾ ਆਪਾਂ ਫਾਰਮਰਸ ਦਾ ਭਲਾ ਕਰ ਸਕਦੇ ਆ। ਕਿਉਂਕਿ ਜੇ ਫਾਰਮਰ ਜਿੰਦਾ ਹੈ, ਤੰਦਰੁਸਤ ਹੈ, ਹੈਲਦੀ ਹੈ, ਤੇ ਤਾਂ ਹੀ ਸਾਡਾ ਪ੍ਰੋਫੈਸ਼ਨ ਜਿਹੜਾ ਉਹ ਚੱਲੇਗਾ। ਸੋ ਮੈਂ ਸਾਰਿਆਂ ਦਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ ਕਰਦਾ। ਜਿਹੜੀ ਕਿ ਮਨਦੀਪ ਜੀ ਤੁਸੀਂ ਇਨੀਸ਼ੀਏਟਿਵ ਇਹ ਲਿਆ ਡਾਇਰੈਕਟਰ ਸਾਹਿਬ ਦੀ ਸਹਿਮਤੀ ਨਾਲ ਵੀ ਜਿਹੜੇ ਵੈਬੀਨਾਰ ਦੇ ਪਾਰਟਿਸਪੈਂਟਸ ਨੇ ਉਹਨਾਂ ਨੂੰ ਸਰਟੀਫਿਕੇਟ ਦਿੱਤਾ ਜਾਏਗਾ, ਇਹ ਬਹੁਤ ਹੀ ਸ਼ਲਾਘਾਯੋਗ ਆ। ਮੈਂ ਤੁਹਾਨੂੰ ਇਹ ਵਿਸ਼ਵਾਸ ਦਿਵਾਉਣਾ ਵੀ ਵੈਟਰਨਰੀ ਕੌਂਸਲ ਦੀ ਪਹਿਲੀ ਮੀਟਿੰਗ ਵਿੱਚ ਹੀ ਇਹ ਡਿਸਾਈਡ ਕੀਤਾ ਗਿਆ ਸੀ ਵੀ ਕੌਂਸਲ ਜਿਹੜੀ ਆ ਟ੍ਰੇਨਿੰਗਸ ਜਿਹੜੀਆਂ ਨੇ ਪ੍ਰੈਕਟੀਕਲੀ ਫੀਲਡ ਓਰੀਐਂਟਡ ਟ੍ਰੇਨਿੰਗਸ ਜਿਹੜੀਆਂ ਉਹ ਬਹੁਤ ਜਲਦੀ ਅਰੇਂਜ ਕਰਨ ਜਾ ਰਹੀ ਆ। ਤੇ ਇਸੇ ਤਰ੍ਹਾਂ ਦੇ ਵੈਬੀਨਾਰ ਵੀ ਜਿਹੜੇ ਹੋਣਗੇ ਉਹ ਵੀ ਵੈਟਰਨਰੀ ਕੌਂਸਲ ਵੱਲੋਂ ਅਰੇਂਜ ਕੀਤੇ ਜਾਣਗੇ ਤੇ ਬਕਾਇਦਾ ਸਰਟੀਫਿਕੇਟ ਦਿੱਤੇ ਜਾਣਗੇ। ਸੋ ਮੈਂ ਇਹਨਾਂ ਗੱਲਾਂ ਨਾਲ ਸਾਰਿਆਂ ਦਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦੀ ਹਾਂ। ਸਾਰੇ ਪਾਰਟਿਸਪੈਂਟਸ ਜਿਹੜੇ ਇੱਥੇ ਸ਼ਰੀਕ ਹੋਏ ਨੇ ਉਹਨਾਂ ਦਾ ਵੀ ਬਹੁਤ ਬਹੁਤ ਸ਼ੁਕਰੀਆ, ਧੰਨਵਾਦ।
ਸਾਡੇ ਲਈ ਬੜੀ ਖੁਸ਼ੀ ਦੀ ਗੱਲ ਹੈ ਕਿ ਅੱਜ 311 ਪਾਰਟਿਸਪੈਂਟ ਸੀ ਅੱਜ ਇਸ ਵੈਬੀਨਾਰ ਦੇ ਵਿੱਚ। ਤੇ ਇਕੱਲੇ ਪੰਜਾਬ ਹੀ ਨਹੀਂ, ਪੰਜਾਬ ਤੋਂ ਬਾਹਰੋਂ ਵੀ ਸਾਡੇ ਕੋਲ ਬਹੁਤ ਜ਼ਿਆਦਾ ਪਾਰਟਿਸਪੈਂਟ ਸੀ। ਮਲੇਸ਼ੀਆ ਤੋਂ, ਇਸ ਤੋਂ ਇਲਾਵਾ ਬੰਗਲਾਦੇਸ਼ ਤੋਂ ਵੀ ਸਾਡੇ ਵਿੱਚ ਪਾਰਟਿਸਪੈਂਟਸ ਨੇ ਜਿਹੜੇ ਅੱਜ ਇਸ ਵੈਬੀਨਾਰ ਨੂੰ ਅਟੈਂਡ ਕਰ ਰਹੇ ਨੇ। ਇਹਦੀ YouTube ਦੇ ਉੱਪਰ ਰਿਕਾਰਡਿੰਗ ਵੀ ਹੈ, ਤੁਸੀਂ ਬਾਅਦ ਦੇ ਵਿੱਚ ਮੈਂ ਲਿੰਕ ਸ਼ੇਅਰ ਕਰ ਦਾਂਗਾ, ਤੁਸੀਂ ਦੇਖ ਸਕਦੇ ਹੋ। ਸੋ ਮੈਂ ਅਖੀਰ ਦੇ ਉੱਤੇ ਫਿਰ ਡਾਕਟਰ ਸਵਰਨ ਸਿੰਘ ਰੰਧਾਵਾ, ਜਿਨ੍ਹਾਂ ਨੇ ਬਹੁਤ ਹੀ ਵਧੀਆ ਤਰੀਕੇ ਦੇ ਨਾਲ ਇਹ ਸਾਰੇ ਸੈਸ਼ਨ ਨੂੰ ਸਾਡੇ ਨਾਲ ਐਕਸਪਲੇਨ ਕੀਤਾ। ਸਾਡੀ ਇੱਕ ਬਹੁਤ ਵੱਡੀ ਜਿਹੜੀ ਫੀਡ ਦੀ ਪ੍ਰੋਬਲਮ ਹੈ ਜਿਹਨੂੰ ਇੱਕ ਸੋਲਵ ਕਰਨ ਦੇ ਵਿੱਚ ਸਾਡੇ ਮਦਦਗਾਰ ਹੋਏ ਨੇ। ਸੋ ਉਹਨਾਂ ਦਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ। ਮੈਂ ਫਿਰ ਰਿਪੀਟ ਕਰ ਦੇਵਾਂ, ਕਿਉਂਕਿ ਜਦੋਂ ਇੱਕ ਵਾਰੀ ਖਤਮ ਹੋ ਗਿਆ ਵੈਬੀਨਾਰ, ਉਸ ਤੋਂ ਬਾਅਦ ਤੁਹਾਡੇ ਕੋਲ ਲਿੰਕ ਨਹੀਂ ਅਵੇਲੇਬਲ ਹੋਏਗਾ ਤੇ ਉਸ ਤੋਂ ਬਾਅਦ ਸਰਟੀਫਿਕੇਟ ਨਹੀਂ ਮਿਲ ਪਾਉਣਗੇ। ਸੋ ਮੈਂ ਫਿਰ ਬੇਨਤੀ ਕਰ ਦੇਵਾਂ ਕਿ ਜੇ ਤੁਸੀਂ ਸਰਟੀਫਿਕੇਟ ਚਾਹੁੰਦੇ ਆ, ਲੈਣਾ ਚਾਹੁੰਦੇ ਆ। ਹਾਂਜੀ ਡਾਕਟਰ ਰੰਧਾਵਾ ਜੀ।
ਮਨਦੀਪ ਜੀ, ਮੈਂ ਇਹ ਕਹੂੰਗਾ ਆਪਣੇ ਪਾਰਟਿਸਪੈਂਟ ਨਾ ਵਿੱਚੋਂ ਕਈ ਹੈਂਡ ਰੇਜ਼ ਕਰ ਰਹੇ ਆ, ਜੇ ਕੋਈ ਉਹਨਾਂ ਦੀ ਕੁਐਰੀ ਹੋਵੇ ਤਾਂ ਇਹਨਾਂ ਨੂੰ ਪਲੀਜ਼ ਮੇਰਾ ਨੰਬਰ ਦੇ ਦਿਓ ਤੇ ਉਹ ਭਾਵੇਂ ਮੈਨੂੰ ਫੋਨ ਤੇ ਗੱਲ ਕਰ ਲੈਣ।
ਸਰ ਇਹ ਸ਼ੁਰੂ ਤੋਂ ਹੀ ਰੇਜ਼ ਨੇ, ਇਹਨਾਂ ਨੂੰ ਆਵਾਜ਼ ਨਹੀਂ ਆ ਰਹੀ ਜੀ।
ਹਾਂਜੀ,
ਇਹਨਾਂ ਨੂੰ ਆਵਾਜ਼ ਦੀ ਪ੍ਰੋਬਲਮ ਸੀ, ਇਸ ਕਰਕੇ ਇਹਨਾਂ ਨੂੰ ਉਹਨਾਂ ਦੇ ਹੈਂਡ ਰੇਜ਼ ਨੇ ਜੀ। ਉਹਨਾਂ ਨੂੰ
ਤੁਸੀਂ ਵਿੱਚ ਹੀ ਰੋਕ ਦੇਣਾ ਸੀ, ਆਪਾਂ ਫਿਰ ਦੁਬਾਰਾ ਦੇਖ ਲੈਂਦੇ।
ਪਰ ਉਹਨਾਂ ਨੂੰ ਮੈਂ ਸ਼ੇਅਰ ਕਰਤਾ ਸੀ ਵੀ ਕਿਵੇਂ ਤੁਹਾਡੀ ਆਵਾਜ਼